ray of light passes through a transparent object, and so there is a change in the direction of the light. So this we call as a refraction. So 70% of that refraction, or what we call as a focusing, happens in front of this cornea. And the other functions of the cornea are it protects from the external damage. And this is one tissue in the eye which doesn't have blood vessels. That means there's no blood supply to the front surface of the cornea. So why is this important is, why we need blood supply is it basically provides oxygen and nutrition for any tissue. But the cornea doesn't have blood supply. So how does it get nutrition? It gets nutrition from what we call as a tear film, which is nothing but tears. So in front of this cornea, we have a very thin layer of tears, which we call as a tear film. And the cornea gets nutrition from the tears. Just one second. So next slide. Okay, and the iris, as I mentioned, that it gives color to the eyes, and in the center is the pupil. So the pupil actually controls the amount of light. This central pupil controls the amount of light entering the eye. That means if you're in a bright light, the pupil becomes small, allowing only a very minimal amount of light to enter the eye. And if you're in a dim light, the pupil gets bigger and more light enters, so that it helps you to see clearly. So I'm skipping this slide. Okay. So what is the function of the lens? So this is the lens in the eye. All of us are born with a natural lens in the eye, which is a convex lens, which is crystalline and clear. So this helps in focusing the light in front of what we call as a retina. The retina is the sensitive layer of the eye. So whatever we see, the image of that object falls on the retina, and then the retina converts that image into an electric impulses, and then this message, the impulses goes through this optic nerve all the way to the brain, and then the brain tells you what exactly are you seeing. So coming to the today's topic, the computer vision syndrome, it's something that has to do with this tear film. So this tear film is a thin layer of tears which coats the front surface of the cornea. And it has three important layers. So one is the mucus layer, one is the aqueous, and the lipid. The mucus layer is a thick, sticky layer. It helps the tear film to stick to the cornea. And the aqueous layer, which is this major part of the tear film, which is blue in color, as the name suggests aqueous, it's a watery layer. And then the outermost layer is called the lipid layer, which is like a fatty layer. So the aqueous layer and the lipid layer together perform the function of lubrication. And the lipid layer also helps prevent the evaporation of tear film. So why is this tear film important? So the 80% of the refraction takes place, I said like 40% takes place in front of the cornea, the 80% takes place in front of the cornea together with the tear film refraction. So you can imagine if the eyes get dry, how much it's going to affect your clarity of the vision. Okay, and this slide explains how the tears are drained from the eyes. So this tear film which is produced has a life of about 15 to 16 seconds. So after 15 to 16 seconds, this tear film breaks up. So what happens when it breaks up? Then the tears flow along the margin of these eyelids, and they're like tiny holes which we call as a punctum on the corner of the eyes. Through those punctum, this tear flows and it goes into the nose and then into the throat. So actually we can't feel this, it automatically keeps happening. Sometimes when you put some eye drops, then you can actually taste the bitter taste in your throat because of this drainage. So why does this dry eye happen, or what are the mechanisms? So there might be two mechanisms. One is either the production is less, or the quality of the tear film is not great. As a quality, I mean to say, like, a tear film has this mucus, aqueous, and lipid layer. So deficiency in any one of these produces poor quality tears, and this in turn causes dryness in the eyes. So there's various other factors like old age, and they say in women it's slightly more because of the hormonal changes, and also like a few medicines like oral contraceptives and other medications people are taking, antihypertensive and anti-allergic medications can also cause dry eyes. And in children especially, the poor nutrition, a lot of junk food can also cause dry eyes. These are the other conditions like juvenile diabetes. Basically, it's a diabetes in very young age. Environmental factors, which include like air pollution and windy conditions and extreme dry weather, can also cause dryness. So what are the symptoms? So the symptoms, I mean, it's not necessary that everyone has to get all these symptoms listed, but either one of these or two of these things. So either you can present with a redness or pain, fatigue. Fatigue basically is tiredness in the eyes, and burning sensation in the eyes, and episodes of blurring vision. We call it as episodes because this when you have a blurry vision constantly, then it's something else. But blurriness, which happens now and then, it's like there's a blurriness, then you close your eyes and blink few times, your vision gets clear. So then that's the diagnosis of dry eyes. Then you might have like a sandy or some foreign body sensation in the eyes, and also decreased tolerance to screen time. That means you're not able to look at the screen for long. So as I said, it's also known as a digital eye syndrome or computer vision syndrome. So why do we call this like this is? So when you're looking at any kind of screen, like say computer, laptop, or TV or cell phone, what happens is we tend to blink less as often as we're supposed to. Normally we blink 16 to 18 times in a minute. This is involuntary. Involuntary means it's not under your control, it just happens. But when you're staring at a screen, you tend to blink less because you're concentrating on something. So when you blink less, and why is blinking important is, so every time you blink, there's a new layer of tears which is formed. The tear film is formed. So when you blink less, this new tear film is not formed. And as I said earlier, the tear film has a life of about 15 to 18 seconds. So when you don't blink, so obviously there's no tear film formed. And then you have these dry eye symptoms. Basically, the intermittent blurriness, then dryness, itchiness, redness, and all these things start. And then you get this eye strain. So why are you getting this eye strain? There are two causes. One, as I said, like 70% of the refraction is taking place in front of the tear film. So when the dryness is there, that refraction is affected. And the other thing is, when you look at the letters in the screen, these letters are in the form of pixels. Pixels means each letter is brightest in the center and they fade away at the periphery. We can't actually make that art because our eye muscles are constantly working to help us to see clearly. That's why we can't make that pixel pattern. You can just see uniformly like a bright or dark letters. So these eye muscles are helping you to see clearly, to overcome the dryness and also overcome this pixel effect. But then it also has some limits. So these eye muscles are also like your biceps or triceps. Like when you go to gym, when you're doing exercise, there's a limit where you can only do to a certain extent. Then you start getting body aches, like muscle aches, all those things. Similar thing in the eyes, these muscles work for a certain time and then they give up. That's when you get this eye strain in the form of eye aches or headaches or redness and all these things. So these are the things I just explained. So this is about the blinking I was explaining. So even the air-conditioned rooms can also cause faster evaporation of the tears. And low humidity is also known to cause that. And also if you're traveling in an aircraft, even there, because it runs on AC, so you get frequent dry eyes there as well. So what are the other things that can happen apart from the eye strain? And I said eye aches and eye strain, redness and all those things. What other things can happen from the dry eyes is, one is more prone for eye infections, because this tear film also has a lot of antibodies and it fights against infection. So when this tear film is not there, then you're more prone for eye infection. And damage to the surface of the eye. The dry eyes are more prone for damage, especially the cornea. And decreased quality of life, because there's decreased performance in whatever work you are doing. So there are few steps to get relief from this computer eye strain. So I'll go one by one. So obviously, first thing is you should get a basic eye examination checked to rule out if you have any refractive error. Refractive error, I mean, like if you have any spectacle power. So you should get that checked. So obviously, if you have a refractive error, you get appropriate glasses and then you start wearing them. So, and then when you're using screen, there are a few things that you must make sure. You must avoid direct bright light falling on the screen. So you have to preferably keep the lights either behind the screen, and also the windows shouldn't be opposite to the screen. They should also be either preferably onto the sides of your screen. So you must plan to keep your laptop or desktop or any kind of screen in such a way that there's no direct bright light falling on the screen. So it creates unnecessary glare to your eyes. And the positioning of the computer. So the computer should be positioned at your level. It shouldn't be too high or too low. And there's also other things. You can install an anti-glare screen on your monitor, or you can wear what we call as a blue cut lenses, we call, or anti-glare glasses, which also help in cutting this glare to about 40%. And LCD screens are better than the old tube style monitors. I don't think anyone uses those old tube style monitors these days. And the higher the resolution, the lesser the eye strain. And also the screen size. The larger the screen size, also the lesser the eye strain. And the contrast, the best contrast would be the black and white, which will be the best for the text. Instead of keeping a color background, if you keep black and white, simple, that's better. And as I said, blinking is very important. So there is a simple rule. What we tell our patients is follow a rule called 20-20-20. So that means for every 20 minutes, you take a 20-second break, which is very much possible. 20-second break means you just close your eyes for 20 seconds and again start working. So you just need to make it a habit. Every 20 minutes, close your eyes for 20 seconds, again start working. And then in between, like say after every 1 hour, 2 hours, you can take another break, what we call as a 20 feet away break. That means you stand in front of a window or stand in front of a door and stare at an object which is 20 feet, which is 6 meters away. So what happens is when you're staring at a far object, all the muscles in your eyes, they go into a relaxed state. When you're staring at an object which is close to your eyes, eye muscles are working. So when you stare at a far object, all the eye muscles go into relaxed state, then you're giving rest to your eyes. So this is a simple 20-20-20 rule. So it's the same thing that I explained. So these are the specifications to keep like where to keep the lights, where to keep the desktop. And as I said, the center of the screen should be like 10 to 15 degrees below your eyes for comfortable positioning of your head. Because improper position can also, apart from giving the dry eyes and eye strain, it also can give you backache and neck aches and all this stuff. So as I said, modify your glasses like to customize for the computer use, which is nothing but you add an extra filter, what we call as a blue filter. And for someone who is over 40 years of age, they might need what we call as a progressive glasses, because after 40 years of age, your focusing capacity becomes low for the near vision of for the small prints. So then, I mean, you can use reading glasses, but the reading glasses are just for the near vision. They don't work for the intermediate vision, because in the distances we divide into three types. One is a far distance, which is 6 meters. Near distance, which is 30 centimeters, which is a reading distance, and the intermediate distance is 60 centimeters, which is a desktop or laptop distance. So when you just use the reading glasses, they cover only the reading distance, not the your computer or desktop distance, which is 60 centimeters away. So for that, you need to use these progressive glasses. And the other things that you can do is drinking plenty of water and eating healthy food, fruits and vegetables, especially vitamin A and E sourced foods. And I said junk food can also cause this dryness. And when should you consult a doctor? So whenever, if you're feeling one of these symptoms, as I said, red eyes or something growing on your eye, this fleshy thing growing on the eyes from the constant irritation and frequent drying in the eyes, it's called a pterygium. And if you have other symptoms like joint pain, swelling, and stiffness, because there are some diseases where it can cause, you can get dryness in the eyes. If you have excess dry mouth and dry eyes not responding to the self-care measures, like as I explained to you, like if you're following this 2020 rule, but you're still not feeling a relief, then that's the time you need to see a professional. So that was my last slide. So I also need to add something for this. Apart from doing all these things, there are like various lubricant eye drops also available, because especially these days, like because of the IT hub now, a lot of software engineers, they come with these problems. So for them, it's like an ongoing problem. Now it's going to be an ongoing problem for even the school kids, and also because everything is online now. So we also, first we try to treat without any eye drops or anything like that. But if you're not getting relief from this, then we do suggest to use some preservative-free lubricant eye drops. Lubricant eye drops are nothing but these are artificial tears, which replenish your tears, which are not, suppose if you have a problem in production of tears due to any other diseases, then no matter what you, whatever the things you follow, you might still have dry eyes. So that's when we prescribe you eye drops. So that was my last slide. Oh, thank you.
All right, Dr. Venkateshwar, thank you so much for this fruitful information. I'm really sure that it's going to help to students very much. Now I want to request all the children, if you have any doubt, you can raise your hand, ask it directly, or you can write down in the chat box so I can speak out loud. So, sir, in our chat box, we have some questions from the children. So the first question is from Hemant Kumar. He want to know that can we know about IBP?
IBP. Okay. Okay. I think he's asking something about the intraocular pressure. Okay. So just to help patients understand in a simple way, few doctors use that word IBP. Like we have blood pressure. So everyone knows what is blood pressure. Okay. When blood pressure goes high, we call it as a hypertension. So similarly, even the eye, inside the eyeball, there is some pressure in the eyes, which is usually below 20 millimeters of mercury. So this pressure in the eyes, we call it as intraocular pressure. So few doctors call IBP just to make it simple for the patients to understand, because this increased pressure in the eyes also can cause something called as a glaucoma. Okay, that's a totally different topic altogether. Yeah.
All right. Thank you so much for this answer. So the next question is from Pallavi S. She is asking that if we have spectacles power, can it be decreased or operation is the only way of getting rid of these spectacles?
Okay. You see, until 18 years of age, there are changes happening in the eyes. Okay. So if you have power, I mean, refractive error, what we call, so you need to wear glasses. I think your question was, can you do something without surgery to get rid of
Yes,
the glasses? So that's what she
yes,
wanted to know.
yes.
Small refractive error, if it is just like 0.5 or 0.75, so you can just do a few eye exercises, which we usually tell, like keep a finger close to your eyes, then bring it far, bring it close. So that's going to increase the strengthen the eye muscles. So these small refractive errors you can overcome. But if it is usually more than 0.75, then you need to wear your glasses. That's the only way. And if your power persists even after 18 years of age, then we can do some laser to get rid of the glasses. Yeah, but the higher power, you can't really do anything, because this power comes because of the change in the length of the eyeball. If your eyeball is longer in length, I mean by birth, you become short-sighted. If your eyeball is shorter in length, you become long-sighted. So there's no way we can alter that length of the eyeball.
All right, sir. Thank you so much for this answer too. So we have a next question is from Anirudh. He's asking that uh, whenever I read too much, I get the headache at the backside of the head. So why is it that? What is the reason behind it?
Okay. See, headache is such a thing. There are like some thousands of causes for it. Okay. Um, so if you're getting only when you're reading, so I would recommend you to first check if you have any refractive error. That means check if you have any spectacle power first. Okay. And then if you have spectacle power, obviously you need to wear glasses, especially people who have plus for power. If they don't wear glasses, they get these headaches. Okay. Or it might be other simple thing, like as I mentioned now, if there's a like a eye strain you're getting from the dry ice, it could also be, but I can only tell when I see you or examine you. Yeah. So, but I'm just saying possible causes could be this.
All right, so thank you. Anirudh has replied that he is wearing spectacles.
Okay.
So yeah, so we
And
can
people
go.
who are wearing spectacles also, especially chill, I don't know how old is he now. Before 18 years of age, I mean, you need to get your eyes checked yearly once without fail, because there are a lot of changes that can happen in this age. So suppose if you had checked your glasses before 2 years, say 2 years back, and you're still wearing the same glasses and your power might have changed. Okay, so it could also be that.
All
Or
right.
you got your glasses recently, then the headache might be from different cause. Yeah.
All right, doctor. Thank you. So next question is from Anna. She want to know that there is any other way to get rid of glasses. Like
Otherwise, in the sense, as I mentioned, like small refractive error, you can do some eye exercises and get rid of that. And higher refractive errors, you have to wear glasses, especially, I mean, if you're under 18 years, but over 18 years, yes, there are options as the LASIK, smile procedures. There are a lot of procedures for that. Only if you're 18 plus.
all right, sir. So next question is from Hemant Kumar again. He's asking that if a person has glaucoma, how can we overcome or how to treat it?
Okay. So glaucoma is again a different topic, but I'll just tell you in a simple way. As I told you, like our eyeball is connected to the brain through a nerve called optic nerve. Okay, so glaucoma is a disease of this optic nerve. So usually what happens is, as you previously one of you asked, IBP. So if the pressure in the eye goes high, this optic nerve starts getting damaged. So this optic nerve is like a wire connecting from eye to the brain. So once this optic nerve is damaged, then there's no message going to the brain. Then you can't actually see. Your brain can't tell what you're seeing. So, and this glaucoma is a genetic thing. So there's nothing that you or I do to get this. It just happens. It's a genetic thing. Usually, like if you have a family history, like if parents or grandparents had, then there's a 40% chances that it might be passed hereditary. So if you get your eye examined, checked, and if someone diagnoses glaucoma, it can be treated. It can't be reversed, but it can be treated and stopped where it is with eye drops or rare cases surgery also.
All
But
right,
you,
sir.
yeah, but you
All right.
can't like really prevent it from happening.
Okay, I'm sure all the children are getting their answers. So the next question is from Sanjay. I think they might be already having their answer, but still I repeat.
Sure.
I watch classes from morning to evening. So what precautions should I adopt for prevent my eye? So as doctor has explained the 2020 rule
Yeah.
and the blinking rule. So if you want to add something, doctor, it's up to you.
Yeah, you see that 2020 rule, as I said, like I'll just repeat that because that's the most important point for today's take home message. So every 20 minutes, you just close your eyes for 20 seconds, again start working. And in between the classes, like because in between classes, if there's like a 5 or 10 minutes gap, or you get like snack break or lunch break, so that time try to avoid screen at least that time, because most I've seen, like even with my own child, even in between classes they jump to these games and stuff. So I mean, obviously you have to avoid that. And then staring at a far object, which I said, for a few minutes, which will also relax your eyes. Yeah.
All right. All right. Thank you so much for this answer too. So, sir, this next question is, our name is not there, but how can I prevent certain eye disease from occurring?
This is very vague question, but in general, you eat healthy food, as I said, like vitamin A and vitamin D rich foods. As I said, like all the fruits and vegetables, whatever looks green in their original form, the like the raw vegetables and fruits are the healthiest way. I mean, these do have a lot of vitamins which are required for a healthy eyes. So you can do that. And also the eye exercises, as I was telling you, like taking a finger, keeping it close, then take it far close, so that you can repeat it few times. So this will help to keep your eyes in general healthy. And when you get time, like, I mean, when the conditions are favorable, I mean, I would encourage you to go out and play rather than sitting inside the home, because your eyes, especially when you're a child, they're still developing. So if you give them only near object, your eyes will develop that kind of refractive error. You get short sightedness. So you should also give it a far stimulus. That means you go out and play. Then you are giving equal opportunity for the eye to develop both near and far sides.
All right, sir. So, sir, there is one question. What about dry eyes as soon as I woke up in the morning? So the student is
Mhm.
facing a problem of the dry eyes in the wake up in the morning. The eyes is dry.
Okay.
What he can do? Yeah.
Um, Usually it's very uncommon, especially when you wake up in the morning. Your eyes are actually nice and fresh, fully rested. But in extreme dryness, it can happen. Okay, so for those people, we have like what we actually prescribe a gel. The same lubricant drops I was saying, it also comes in the form of a gel. It's like an ointment that one can use in the night before going to bed. You just pull your eyelid like this and put it inside the eyelid before going to bed. So this prevents dryness during the night, and also you wake up fresh without dryness in eyes.
All right, sir. So I think we can drink more water and do this exercise can help, right,
Exactly,
sir?
exactly.
Yeah. Yeah. So, sir, there is one multiple student have asked one question about laser surgery, that it is safe to do a laser treatment. They are like very worried because they are at their college, and in this age they can do this surgery. Many of the students must be wearing glasses nowadays,
Yeah, yeah.
as we see. Yeah.
Okay. So as I said, like this laser is safe to undergo. It's been there for many years now without any side effects or anything like that. But as I said, like there are some prerequisites for that. One is your age. You should be between 18 and 35, 36, like that. And other thing is, like as I mentioned, the front part of the eye, the cornea, there should be a minimum thickness of that cornea which we measure before the surgery. So not everyone can undergo surgery. Only when we measure the thickness, if there's enough thickness, only then we do the laser surgery. But yes, they are safe, and they're safe to undergo. No problems.
All right, sir. So just I will not bother you more. Just last question of the day.
Sure.
So, Palvi want to know that what is the main reason of increasing spectacle power of eyes?
Of increasing spectacle power of the eyes. Okay.
Yes.
So as I said, like until 18 years of age, there's still growth happening in the eyes. So you can expect changes in the power. Sometimes it can decrease, sometimes it can increase. We can't really tell. So up to 18 years of age, if the changes are happening, that's normal. But if the changes are happening with too much, look, every year like 0.25, zero point 0.5 changes, it's okay. But if the changes are happening rapidly, like this year you are like -1, next year you're -3, okay, then there are certain conditions we need to rule out. There's a condition called as a keratoconus and some degenerative conditions, what we call in medical terms. Those things we need to rule out, and they can be treated. Okay,
All
but
right, sir.
but smaller degrees, it's
Hmm.
acceptable. Usually after 18 years of age, it stays stable until 40 years. Because at 40 years, you have another problem where you get difficulty reading smaller prints, and that's a different thing. That's an age related one. Yeah.
All right. So, sir, there is one thing that student also asking in the chat box. Can you just provide again with your hospital to visit to you, the to your hospital information, so they can see you regarding eye treatment or anything?
Okay.
Yeah.
Sure, sure. I'll just give the details here.
Yeah. So they can see on the screen, so it can help them.
Sure, sure.
As I already introduced that you are from Agarwal Eye
Yeah.
Hospital, Bangalore, but still it helps them. Yeah. Hi, so I just want to request all the
Mm-hmm.
students who have asked in the chat box, you can write down the address doctor is sharing with you, and you can visit anytime. You can take the prior, you can call first, and then you can go and connect with the doctor if you're facing any problem relating to eyes.
So that's the contact number there. So they can contact. You can see the slide, right?
Right, sir, right. We can
Okay.
see it.
Yeah.
Yeah.
So that's not my contact number. That's a contact
Ah,
number of the hospital.
of
So they
the
will guide you. Yeah.
exactly, sir, exactly. Thank you so much, doctor, for the
Sure.
this fruitful information. I really want to thank you again. I also like to thank you all the students who have joined from the college. So it was a very grateful session and an experience, and I'm sure students also will get in, in check in connect to you, because there are a lot of students seem interesting in the chat box as well. So
Yeah.
I'm sure everyone getting all the doubt clear. So thank you everyone for joining today.
And thank you so much. Hope this was a useful talk, and everyone has some take home message. Thank you so much.
Thank you so
Okay.
much, sir.
Thank
Thank you. Thank you, doctor.
Okay.
Hi, Smriti.